Well, that takes us down to our local treatment provider updates. I think we're starting at the end of the alphabet today, so that means Reclaiming Lives Recovery Cafe gets to kick us off.
Hi, everyone. Good to see all of you, or some of you. We have returned to holding circles only in person. So cafe is still closed as far as serving food due to the restrictions on takeout only orders for the restaurant. So we have about 11 circles that meet every week, and those are taking place in our 5 conference rooms with distancing. All of those are under 10 people. So it's been a challenge to go Zoom, not Zoom, in person, not in person, but we're we're doing what we can. So we also are excited to announce that the podcast link will be available on Monday. We'll send it to Jennifer to send out to the committee, and we have 3 episodes. The first one is Brandon and Christy's story, a little bit of details involved, but what led to, their addiction, then prison, and then their recovery. And then episode 2 is Leading by Example, which is awesome to hear who mentored them and how they're mentoring others. And then the 3rd episode is about peer support and working in the field based on your lived experience. And I'm just really proud of our team for how that's all come together, and appreciate the fact that we were able to use CARES money to move that forward statewide. So I'm a little excited, but like having a baby, is everyone going to think it's ugly or cute? I don't know.
Are we going to think it's ugly or cute?
I think it's amazing, but I love my people.
I love it.
Yeah, it's really cool just to hear their perspective on recovery. And I think, the lessons that they've learned in a really casual, fun atmosphere. So I'm excited to have you all be a part of that. Let's see, we also have new space in downtown Medford that we have ordered furniture for, and that's under construction. So we will have an entrance that's street side. Right now we're in conference rooms upstairs from Rogue Organic Cafe. So we're enlarging our space by 1,600 square feet. And with Brandon and I and Christy working in pretty small areas, different days of the week, but being able to have those additional conference rooms to serve people, if it makes sense, like we're taking our large space and making it smaller for COVID in a way, but we're excited to have that signage and street side location downtown. So Brandon has engaged with 3 people coming directly out of prison in the last week, and he has 2 appointments next week. So we continue to pursue those people who are incarcerated and are coming out. So a number of people are getting released early. Kate Brown's moving them out. So we're taking them on and excited to help them connect with resources. And our partners, as usual, have been amazing in helping us do that. Number of people who have been really solid or struggling with relapse. I hate to bring that up again, but it is really crazy out there with the holidays and just the uncertainty around how long COVID will last, and access to just different treatment being a wait, and I don't know, just challenging times. This weather is not helping either. So we're doing everything we can and to engage people on social media. And Brandon, Christy, all of us make phone calls every single day and are texting our people and just trying to keep them engaged in positive ways. And we have oriented a lot of new people lately. So if you have people you want to refer to us, please give them our number and we'll set up an appointment for a one-on-one to get them to fill out the paperwork to be at Recovery Cafe and in a circle as soon as possible. So that's kind of where we're at.
Another thing I want to point out is it's incredible that even through COVID, through the prison systems, our name is even getting out there, and that we're getting phone calls and people are reaching out to us for help. It's outstanding. I'm really proud of the work we're doing here, and I'm just really excited to keep it going. I'm glad that we were able to find motivation through all the COVID distress, but we are still moving forward, and we're not stopping. I'm super happy with the work we're doing and everybody else in our community. So I want to thank you guys for walking alongside us and helping us along our way. Thank you.
And Christy's working with a number of people who are wanting to enroll at RCC, SOU, and in different trades. And so we're still on that governor's committee to see if we can be a part of the rollout for Redeeming Scholars, which is people formerly incarcerated or those coming out of incarceration to be assigned a peer support person to help them engage in higher education. So those are all places that we're, kind of putting our efforts towards, and we'll continue to do that in the new year, along with all of the work around Recovery Cafe and holding those people in our space and being able to support them with connections with people of like mind and, positive influence. So thanks for all of the referrals and the support you guys have given us. Appreciate it.
Thank you, guys.
All right. Oasis. Let's see. I'm not sure if Kristen was here, but did we have somebody else from Oasis that could? Okay.
Yes, I am here.
Renee Dodge was on.
Oh, Renee. Nice. Renee. Yours today. Thank you.
Hi, everybody. So Oasis is just crazy busy. We have definitely been seeing a lot of relapse going on out there. COVID, the holidays, everything. Dr. Hecox is just running like crazy here. We're really still trying to build our pregnancy program, which has really started to kick off pretty well, actually. We're getting a lot of pregnant mamas in here, but keeping them engaged to, out of treatment, to get into treatment has been a really big struggle, but we're just really pushing forward and keeping at it. So no other updates than that.
Well, I appreciate all of your updates, and I know confidentiality and protected health information, but if you could just show like baby videos when you come in, maybe we'll make that part of our official meeting.
Yes, I love that story.
So really always inspired by your work. Thank you for sharing that. All right. Medford Treatment Center. It's been about a month ago that I got to tour, that Kyle Gray gave me a tour of it. It was beautiful. It was clean. It was professional. It was trauma-informed and accessible. Kyle gave me an email back asking me about 3 things. And at the end of that email, he said, "Go Ducks." I have not responded to those 3 things, Kyle. I'm sorry. And the Ducks, since you sent that email, have not gone well. So
It's been tough.
I'll see what I can do to remedy my part of it. But welcome. Thanks.
Well, the Ducks got a big game on Friday, so I still have my hopes up. So
championship caliber team. We earned it.
Right. We got there. That's all that matters. So things at Metro Treatment Center they're moving along. As we approach our 90 days open, our 90th day will be on Monday. We actually just secured additional space in the building next door, the upstairs. So we have some additional space there. It's been difficult navigating COVID, as we typically see over 100 clients a day that walk through our doors in our roughly 4 hours open. It's tough to with a smaller lobby to try and keep employees and clients safe, but we're navigating that as best we can. One of our big things that we're doing right now is we've actually started doing client satisfaction surveys. We do that at our other facilities once a year. So we're actually getting feedback from our clients in a survey that we created via SurveyMonkey. We get those results back at the beginning of the year, and then we kind of review that and see what areas we can improve on. But things are going good. We're growing exponentially. We're serving clients that need us, and I'm really proud of my staff. And I'm happy for this additional space that we've secured, so that we can continue to serve more people as we need. So that's what we've been doing.
Appreciate the update, Kyle, and glad you guys got your feet beneath you and you're moving forward. It's exciting. Julia, did Julia get to join us today from Max's Mission?
Yes, I am here.
Oh, awesome. Great. Thanks.
So good to be here. So we will be in Alba Park tomorrow with a naloxone event. Training and free naloxone could be in the gazebo if it keeps on raining like this, but we will be there from 2:30 to 5. We continue to service our boxes throughout Jackson and Josephine County, expanding them in Josephine County to Wolf Creek and to On-Track's building in Cave Junction, which they have just purchased. So we're excited about that. I was talking to the fire chief in Wolf Creek this morning, and there was an overdose death 2 weeks ago from a 39-year-old. So we're keen to get as much naloxone out there at this time of year. We know there's often a red alert around Christmas. And so if anybody, if people need to reach out to us, other agencies, please feel free to do that. And we are happy to put on another event if needs be between Christmas and New Year or whatever happens. So open to input there. And continuing to work with the OHA on the harm reduction clearinghouse that is open, and I think they have spent all the money so far this year, but it will reopen in January with more funds for naloxone and PPE and other harm reduction equipment.
Good luck on the weather this weekend, Julia, and it's neat to see. I mean, it's sobering to hear, but it's also neat to see the number of boxes you've been able to put out through our community and just what that does to access. And so really impressed with that work. Thank you.
Thank you.
Sarah, you're on for a La Clinica update.
I am. So for people who might want to get treatment for opiate use disorder in primary care, that would be something in particular that La Clinica could offer. We have 18 X-waivered providers. 3 of those are midwives. It takes right now about 1 to 2 weeks to get in. It has to do with holidays and whether the person requesting care wants to go to a specific site or not. It might take a little longer to get them in. We're doing hybrid care in person and telehealth. We have 3 providers doing groups, and they're mostly virtual. We are cooperating, as I understand it, with Medford Treatment Center and Allied, so that if someone needs help right away, that is where they need to go. But we can cooperate so that they can get into primary care and not have them have to start the clock over again to get into care. And I think that's it.
Justin from Boulder. Justin, it looks like your name is Justin S. Boulder, which is a very punk rock kind of name. I kind of like that, but any updates on Boulder Care?
We could start a band.
Right. Man.
or at least a label.
Okay.
Hey, everybody. Good to see y'all. We have recently started working with Regions, which is awesome. We have a partnership with them as well. We are, working with the Jackson County Community Justice Center, serving some of those individuals, and moving forward with, in terms of Measure 110, Boulder's stance on it is that, we believe that telemedicine, is definitely part of how Oregonians will be able to get care. And we hope to be, continue to be part of that discussion, because we think it's, we know it works, and we want to help however we can. So other than that, no other updates. Okay,
I have Kim from ARC, but Lori, if you want to take the ARC, yeah.
Yeah, Kim couldn't be here today, but in addition to seeing how DATRA rolls out and what the impacts of that will be, we're anxious to see. We're also still working on planning for the rollout of Heart Village, which is a tiny house village that we're doing in partnership with Rogue Retreat. And it will have the capacity for anywhere from 12 to 24 people at any one time. And we're excited to see that. Next step is meeting with City of Medford planning in January. So.
We have added Dr. Adam Trotta about Southern Oregon MAT community. And Dr. Trotta, if you are still with us, and I haven't been able to tell on all of that, he might have had to jump off there.
Susan is here, though.
Susan is good. Yeah, Susan Sanchez. If you wouldn't mind giving us an update on what's been going on and how that group's been doing.
So we are not serving patients at Stewart Meadows any longer. We're that's been put on hold, but I do appreciate our community partners stepping up and taking over the care of those patients while we had to switch gears. And Dr. Trotta is kind of figuring out his new role in the community, but he remains very passionate about treating substance use disorders. And so we will see him in a new role soon, I think. And at Providence, we're still committed to the connecting people to help. We're got our hands in all kinds of pots trying to figure that out. So thank you.
So that brings us to closing thoughts. And I just want to thank this group again. I think it is indicative of the amount of people who have invested in this group that the Director of Behavioral Health for the state of Oregon would want to come and at least just say, hey, this is where we're at or what we're thinking. The more you look at the leadership within this group, the people doing the work, the people moving the work, very grateful for it. We'll continue to have discussions around Measure 110, this bold new movement that our state is engaged in. And whenever I have fears and concerns and start to freak out, honestly, it's groups like this that make me think there are some really passionate and intelligent folks putting their thoughts to how we can go forward within this new environment. So with that said, we will get back together in the new year, and I appreciate all your work. Thank you, guys.